Patient came out of the alcove and started choking her almost to the point where she passed out.
Did she tell the hospital or anyone about this?
Oh, they knew it.
What came of it?
Nothing. Nothing.
Acts of violence against healthcare workers occur at a rate 5 times greater than the average worker in our country. And yet most hospitals and healthcare employers in the state fail to adequately address the issue of workplace violence and provide little or no support to employees who are attacked on the job.
And that needs to stop. I mean, we're there to take care of people. We're not punching bags, and we shouldn't have to tolerate it. I mean, you know, and a lot of people, hospitals, think that, you know, it's part of your job. No, I didn't become a nurse to be someone's punching bag.
I sat down with Senator Michael Moore, who filed the first bill to protect nurses, which was unanimously passed in 2010.
The bill we focused on was trying to establish a deterrent and a punishment for individuals who were basically mistreating the people who were trying to provide them emergency care.
The bill mandates a minimum of 90 days in prison or a fine of no less than $500 for anyone who assaults a healthcare provider. But according to the Bureau of Labor Statistics, the rate of violence continues to increase.
That was the first step. Now that we've identified the punishment and the deterrent, now it really, as a lot of other things that we have to address policy-wise, is prevention and education. So now I think that the next step in the progress of trying to address this issue would be establishing education programs, a prevention plan that's going to try to tackle some of the issues of why nurses or healthcare professionals are being put at risk.
I believe it's a staffing issue. We're understaffed in most of the hospitals throughout the state, and people get angry and impatient, and then they lash out, and they lash out at the nurse.
They blame the victim. So it's the first thing they do during what they call a root cause analysis, if it does occur, is they ask the nurse or the healthcare worker, what is it they did wrong?
We do have workplace violence language in our contract, but it's not really utilized. You know, I mean, hospitals do not like nurses to file complaints.
The Joint Committee on Labor and Workforce Development is working on a bill to prevent what has become an epidemic of workplace violence.
Basically what this does is it ensures that the healthcare workers have a plan of action that they can follow if they sense they are in danger, and that takes staff. And that's what we're advocating for the right amount of nurses to be on to do their job, to make their assessments, so that not only they are taking care of our nurses and healthcare professionals, but the patient themselves.
The bill calls for annual risk assessments for each healthcare employer, employee training, in-house crisis response teams, and a fine of not more than $2,000 to any healthcare employer who violates the bill.
And the bill is House 1687, and it's an act requiring healthcare employers to develop and implement programs to prevent workplace violence. They should reach out to their elected officials and tell them why they think this legislation should pass.
I mean, if I was walking down the street and that person assaulted me on the street, I'd have no issue and the police would come and arrest him. So why is it any different when that person is inside the walls of a healthcare institute? I mean, we've been fighting this issue for 15 years, but something has to be done because, you know, people can't go to work and be in fear for their life